Assalamu alaikum everyone. I hope you're enjoying good health. This is Mubarak Ali from Gateway Study Links, and with me I have Mr. Munir. He is a doctor by profession. He is preparing his OET through us, and today we are just trying to check him that how good has he prepared. Initially, doctor, we would be asking you 3 to 4 questions. Rather, I would be asking 3 to 4 questions, and you have to give a general answer to that, so that we get to know how do you speak, how do I talk, and how do we listen to each other. Then we would be going to role play setting. Okay. Normally they give 3 minutes to prepare, but since I gave you the card 2 minutes earlier, so I would be just giving 1 minute on screen to prepare. Are you good to go?
Yeah, of course.
All right. So I would like to know about you. Let me know about you and your plans.
Okay. Good afternoon, sir.
Okay.
I'm graduate from medical faculty last
Okay.
year,
All right.
and I'm here in Pakistan to get my OET degree, as well as I'm here in Gateway Study Links that has professional teachers like you, sir.
Thank you.
I really appreciate it, sir. And also I'm here to, as I said, I'm here to get my OET degree and to apply for the PLAB exam, which is in UK.
Okay.
Yeah, after as a PLAB exam, as you better know, sir, that it requires an OET degree or IELTS degree.
Yeah.
So because of that, I have to take my OET degree.
Yeah.
So that's why I'm here.
Fine, great. So may I know the motivation behind becoming a professional doctor? What motivates you to become, or motivated you to become a doctor?
Sir, as I was at school age, on that time I wanted to be a great doctor.
Okay.
Because my mother suffered from heart disease, so I wanted to become a very intelligent doctor. As you better know, in our country is not much intelligent doctors.
Okay.
So because of that, I wanted to be a very intelligent and great doctor, professional doctor, in order to treat cardiac, or I can say heart problems.
issues.
Yeah.
Okay. Do you remember any of your memories in which you were given a very difficult assignment, and how did you do that assignment?
Yeah, when I was at my first semester,
Okay.
one of my teachers said to me that you have to prepare a presentation for us, and you have to talk about your presentation for about 10 minutes in front of everyone.
All right.
Yeah, on our class, I have about 160 classmates on that time.
Oh,
So
right.
it was really hard for me, difficult for me. Yeah.
Okay.
So on that time.
Munib, sorry to cut you. I guess we're done with the starter now.
Yeah.
Let's go to the main course.
Okay,
Okay. I have given you your role play already.
Yeah.
Okay. The candidate card.
Yeah.
You would be performing as your professional, as you're a doctor. The setting is suburban clinic, and the patient is in his or her 50s. In my case, it would be his. He is complaining of shortness of breath. Okay. So the task is mentioned to you. For you, I would be sharing that on the screen too. And now you have a minute to think about it, prepare it, and then you'll start speaking. Your timer has just been started.
Okay.
All right. Now we got 5 minutes to speak on that. Okay. Since the setting is suburban clinic, so I would be saying hello to you, and then of course you would be starting. Okay.
Okay.
All right. Can I see the doctor here?
Yes, of course. He will be here after 2 minutes.
Okay. So doctor is here?
Yeah.
Please.
Hello, sir. How are you?
Hi, I'm good.
Nice. What seems to be the problem, sir?
May I know who I'm talking to first of all?
Yes, of course. I'm Dr. Munir.
Okay.
I'm a registered doctor. My registered number is 855, and I'm a GP here.
Okay. Okay, great. Actually, before I tell you my problem, let me tell you how does it cause basically, I guess so. Since last 4, 5, 6 months, maybe starting from the previous winter, I'm coughing, kind of whooping cough sometimes, okay? And sometimes if I have a phlegm into my cuff too. So I don't know, sometimes I play golf or maybe I take stairs. So I feel that short breathness mostly, okay, which I think can be part of some regular winter cough or something. I'm not sure about it. That's why I'm here.
It's okay. How often and when do you cough?
Maybe
morning, evening.
You know, when it comes to the phlegming, I would say twice or thrice a day now. It was not that thing before with this frequency, but now it is the case. On the other hand, regularly once I play I'm basically a golf player too. So when I play golf or something, or I take some stairs or something, so I guess I mostly cough.
Can you tell me, have you ever had blood in your calf? In your phlegm, in your expectorations?
I am not pretty sure about it, but I guess once I went into the bathroom and there I think in the sink I found some smudges and blots of blood.
Okay. Do you feel pain while physical activity, normal physical activity, like going upstairs, downstairs, or just something like jogging?
I mentioned that in the upstairs, when I take stairs, I think otherwise I don't feel pain or something like that. I'm pretty fit. I guess it's just a regular, maybe bad cold or something.
Okay. Do you smoke, sir?
I couldn't catch you.
Do you smoke?
Or, yeah, I do. I am a chain smoker. For now, I'm taking 30 cigarettes a day.
Wow, that's
One and a
really,
half packets.
that's really high. That's really high.
You know, but I had been taking it since long. Nothing has happened.
Right now, what's happened that you are here, sir?
Really?
So, how long have you been smoking?
It's been almost 30 years that I'm smoking.
Oh.
Yeah, nothing has
Okay.
happened before, as I told you. I think it's just cold weather, maybe bad weather, or flu or something.
Do your symptoms increase in the cold weather?
Yeah,
During winters?
in the previous winter it happened to me. Before that, I was all fit, healthy, and still I'm doing my activities. Yeah.
Okay. Is there any relieving factors you could do? Maybe you rest. It gets better.
Again, I could not catch you. Come again.
It's okay. When it relieves, like I'm saying that when you have shortness of breath, on that thing, what do you do to relieve it?
Previously, I was taking a cough mixture, which was helping, but now it is not helping as well. When I take cough mixture, even that does not help me. For example, some regular cough mixtures.
What did you do with your calves, with your shortness of breath? Any treatment?
Just cough mixture, I mentioned that. I did not go to any doctor before. As I told you, I'm a player, so I don't think I have any issues like that.
Okay, I'm afraid to say that, sir. To be honest with you, is you have diagnosed with chronic bronchitis. Have you ever heard about that?
No, I don't.
Chronic bronchitis.
I haven't heard about it, neither I believe I have it.
No, I will tell you. You have it right now, sir.
Okay.
So yeah, I will explain it to you and everything you need to know about it. I will explain to you.
Okay.
Let me start, sir. I'm going to talk about chronic bronchitis.
Okay.
It is a chronic disease in which happens in our lungs. The most significant cause is cigarette smoking.
All right.
Yeah, the cigarette smoking damages our cilios. Cilio is an I can say that it's in our lungs, in our bronchuses. It helps us to remove the foreign bodies like dust, like smokes, So when a person is a chronic smoker, this chronic smoking causes to damage the cilios.
Okay.
And also changes the type of cells that we have in our lungs.
Okay.
Like we have some cells called squamous cells, and we have some cells called columnar epithelial cells. Normally in our lungs is we have columnar epithelial cells, which is the normal cells.
Okay.
Which helps us to defend against smokes, dust, pollens, and everything else, and any foreign bodies. But when a person smokes chronically, so it becomes changed to some type of cells called squamous. So it's not doing the normal function. As you have cough, and also you have told me you have a phlegm as well, and you also get coughs mixtures. So you are going to have chronic bronchitis, because this phlegm is not going to out from your lungs. So because of that, you are going to you're having the mixture syrups. Yeah. So
the way you're mentioning that, how are you so sure that I have such thing? I don't think I have it.
I will tell you the sign and symptom of this disease.
Okay.
The most significant sign of this disease is coughs. Coughs, but it's permanent for about 3 months.
Okay.
Yeah. As you better mentioned that last year in winter you had coughs like, and it was permanent as well.
Is it weather affected as well? For example, in the winters, mostly I have it more
Yeah.
than in summer.
This is the definition of the disease.
Okay.
The person who have chronic cough with phlegm, especially in the night season, in the winter season, they are going to have chronic bronchitis. So, as you are a chronic smoker, and it's about 30 years that you have smoking, and right now you have shortness of breath, cough, expectorations, phlegms. So I'm sure you have chronic bronchitis. For what else can I say for you, sir, about your disease? Can you have any question?
First of all, honestly, I'm not satisfied with what you were saying about the bronchitis or something.
Okay.
I don't think I am one
No
of those,
problem.
since it's been 30 years that I'm smoking cigarettes. Nothing has happened before.
Right
And-
now, it happened that you are here, sir. I will because you're not satisfied. I'm going to check your give you some blood test in order to check your WBCs or white blood cells, which is, do you know about white blood cells, sir?
Yeah.
The white blood cells if it arises, that it shows that it's a chronic inflammation in your body, especially in your lungs. So
And without the test, how can you say that it's so true about?
because
I basically think
your
it's
clinic.
it's just, I guess, a bad cold, nothing else.
Yeah, I basically, sir, as you mentioned, you're a chronic smoker, and as well as it gets in the winter season, it increases in winter season, and also
That's matter of
yeah,
just previous winter, not every winter, It's just happened the last time.
last time. Yeah, I got it, sir. I got it, sir. And for your for satisfaction, I will check out your film as well,
Okay.
because in film we can differentiate some diseases,
Okay.
some other diseases.
Alright.
And I'm sure you have chronic bronchitis, sir. You have to, need to trust me, inshallah.
Okay, okay. If you are so keen and acute to say that I am diseased,
Yeah.
so what else can I say? Otherwise, to be honest with you,
Yeah, sir.
I'm making good shots in my golf and I'm very happy with the things I do, and I don't think I have any issues. But still, if you say so, I can provide you samples of whatever you want, and
Oh.
let's see how it comes. But I bet that it's not the case.
Okay, sir. I'm happy to that you have accepted my advices, my opinion.
Yeah.
And I have to say, sir, you have to quit your smoking.
Okay, I'll try my best, but you know, it's been 30 years. It's really tough for me. Even if I don't smoke 2 cigarettes in an hour, it gives me headache or something.
So regarding your smoking question, I am suggesting you to come to our quiet smoking programs we have in our hospitals. I am sure a lot of my patients are they are joined here and they succeed to quit their smoking, to give up their smoking. I'm strongly suggesting you to this course.
Okay.
Okay. And for your phlegm and also for your cough, I'm prescribing you some medicines.
Okay.
You will be better, inshallah.
Alright.
And also, I have to say I'm afraid to say that, to be honest with you, sir, if you continue your smoking, the very it will be very it will have a very bad side effect in long term. I have to say you will have heart heart problems.
Okay.
Right, like we have two type of problems: left ventricular problems, right ventricular problems. So ventricular means the blood. I want to say for you the physiology of our lungs.
Dear doctor, before you make all of my body ill and sick and diseased,
Okay.
I would like to take your leave for now, okay?
It's okay, sir.
And yeah, I would act upon your words, but to me, I'm okay, I guess. I would take just some Panadol or something, I would
No,
be fine.
sir. No, sir. I am not going to leave you like this.
Okay.
Because I am sure I am reassuring you as well. I am just warning you.
Alright.
If you continue your smoking cigarette, you will have a heart attack after 3 years.
Okay. I'll look into
Heart
that.
attack, yeah. And as well as your right side heart will be bigger than normal. We call it cardiomegaly.
Okay.
And after we got cardiomegaly, and after 5 years or 6 years, you will. I don't think you will be alive.
Wow.
Yeah, it's just a warning, sir.
Right, thank you very much for your time, dear doctor. That's the end of your test.
Thank you.
Thank you, Munib. It went well with you, by the way. All right, I'm very happy with the performance overall. Thank you very much for your time, Dr. Munir. I have a few positives and, of course, many negatives in the
Yeah,
talk
of
which
course.
we made, and that's part of my job. As it
Yeah,
was
of
part
course.
of your job to terrify me as much as you could,
Yeah.
you did. If I was taking my notes while you were speaking, and that's how the interlocutor does as well. They have a sheet with them, and in which they try ticking and crossing. For example, that the person was using some uncommon adjectives or not, which I did not find in that overall. Okay, so I'll talk about it. The positive thing about you is that you have touched upon all the points, and I'm very happy about it. You mentioned the things. And the negative point is that you were getting more technical as compared with. It seems like you were talking to a doctor than a patient.
Yeah.
For example, you mentioned and you tried explaining the things, but you were more technical in your explaining. And mind you that this test is 5% your knowledge based. It's 95% your language based. So I was more interested to listen to your language as a commoner who's a smoker, play golf, and he's enjoying his life and he thinks that he's fit and healthy. So your terms like bronchitis and of course you had to touch upon them, but if these things could have been made more specified or simplified, that is a definition your interlocutor wants from you.
Yeah.
Okay. Then in the intro, starting from the introduction, which is not assessed basically, but I would like to give my feedback. You mentioned my OET exam. You mentioned my OET degree. You mentioned it twice or thrice. I am here for my OET degree, to do my OET degree. It was basically, it's an OET exam. Degree program is an extended 3-4 years program.
Oh, I know.
Okay, so it's an exam you want to just attempt. Okay. I did not find initially the introduction that effective, which could have been more better, short and brief of course, because it was not marked. So I had to cut you in the middle so that I could ask you to come to the track, because it takes hardly 30-40 seconds so that we get adjusted with each other while talking. But it was quite dragged, which I think would have been taken care of. I found occasional slips in terms of subject-verb agreement. For example, it damage. It's supposed to be it damages. Maybe in the speaking, such things we don't
Damages,
get.
yeah.
I have my doubts about some pronunciations you pronounced.
of course.
Okay, you mentioned honest, honest, honest 3 times, which is basically honest.
Honest.
Honest, yeah, honest. Honestly speaking, honest. Okay, but you said bronchitis. Is it bronchitis or bronchitis?
Bronchitis.
Okay, so you were saying bronchitis. You would get the
Yeah,
copy
of
of this.
course,
Okay,
of course,
you
yeah.
cannot say that. You cannot
Yeah,
deny it
of
for
course,
now.
of course.
And then I think that you had more knowledge than language fluency.
Yeah.
In the end, I was trying you to not go off topic because you are basically more active with the cardiovascular things or the cardiology. So you were going into cardio again and again, and I was trying to take you out of that because that was not part of the role play. So you went off topic mostly in the later part of the task.
Yeah.
Okay. You mentioned my heart. You said you will have heart attack after 3 years,
Yeah.
and you were supposed to be polite. You see, your card says be tactful, but emphasize the seriousness of the patient's condition
Tactful, yeah.
and the importance of compliance. So you were supposed to be tactful. Now, tactfulness could have been shown through some particular kind of examples.
Yeah.
Okay. For example, if I will keep punching a box again and again and again and again and again and again, in the end, of course, the box will be squeezed, and this is what is happening with your lungs as well, perhaps.
Yeah.
Some examples could have been given. Okay. So that was supposed to be taken care of.
Yeah. Thank you.
Then the pronunciation too. And once I listened to you, you said bad side effects. So side effects are always bad.
Bad, yeah.
Okay. Very important thing, which could have added at least 40 points in your particular speaking. That was part of recapitulation. You recap.
Okay.
Once you're done, you think with that. So you had to give a closing thing. Once you were going off topic, so I had to cut you. Otherwise, in the end, you say, "Thank you very much for your visit. Basically, we have talked about the problems you are facing." Okay, so first of all, you have phlegming issues, you have coughing issues, or such things. So for that, I'm writing some medicine for you. This is the test you have to do, and you will have to come back for a follow-up checkup after maybe 6 days or 7 days or whatsoever days you recommend.
Mhm.
So it was supposed to be a recap of what we have talked about.
Recap, yeah.
Yeah, it could have been the best move, which you couldn't do for
Yeah.
some reason. Other than that, you mentioned if you want to quiet smoking, we have quiet. How did you say that? We have quiet smoking program. What is that? What do you say?
Yeah, quite smoking.
Quiet.
Quite.
It's basically quit.
Quit, yeah.
The word is quit.
Quit, yeah.
Quiet means perfect. So
yeah.
that means perfect smoking programs.
Yeah.
Okay. So it was supposed to be now. Accent does not matter at all in your OET speaking, but pronunciation matters. So wherever I found mispronounced word which had altogether different. For example, imagine the person in 50 is coming and he's having quiet smoking programs, and you tell them that's how you can make rings of your smoke. Or maybe you have to take maybe 40 cigarettes a day to have a quiet smoking. Okay, that was to be avoided. Rest is all right. Thank you very much for your time,
Thank you.
Ji, and thank you very much for listening us as well. Inshallah, we'll be back with you some other day. God bless Pakistan.